Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we're announcing 13 new cases of COVID-19, bringing our total to 243. As of this morning, 8 individuals are hospitalized. Of that, 5 are in intensive care. The number of deaths in Manitoba remains at 4. We're listing 96 individuals as recovered, leaving 143 active cases. On Thursday, Chatham Provincial Lab performed 175 tests, bringing the total of completed tests to 16,383. Again, caution Manitobans to not interpret the recent case numbers to mean that our risk is diminished. We know that this virus is still present, and if we let our guards down, transmission will again increase. We don't have to look far to see the impact of this virus, even in Canada. We see tens of thousands of cases across the country, and unfortunately many Canadians have died. The actions that we take today will be demonstrated in the next couple of weeks. And these next few weeks are vital in Manitoba's response to this virus. We must remain vigilant to flatten the curve of this virus. Part of our biggest efforts is to stay home as much as we can. So this includes not arranging non-essential travel. Now is not the time to be traveling, even to the cottage. The message is to stay home as much as you can. Cancel all non-essential travel at this point. We've asked Manitobans to take significant precautions for a number of weeks, and we may be seeing some of those benefits paying off. The hard work of the public health officials at case finding, case isolation, and contact tracing is also showing some benefits. Every Manitoba needs to do their part, and that means every Manitoban, no matter where you are in Manitoba. It is not safe to assume that this virus is not in your community. You must assume that this virus is in your community. So the message is clear to all Manitobans, no matter where you are, is to stay home, practice social distancing if you must leave your home for essential reasons only, washing your hands frequently, but the best advice, stay home as much as you can. This is ringing true this weekend as the weather increases and there's many holiday celebrations that are usually planned. Do not attend family gatherings. Do not arrange for people to come to your home for a gathering. Do not attend other homes for a gathering. This includes holiday celebrations such as Easter and Passover. We know that this virus is transmitted with close, prolonged contact, which these large gatherings set up transmission of this virus. Stay home. Please connect with the loved ones virtually, but do not have large family gatherings at this point. Do your part to reduce the transmission of this virus. We continue to work on innovative ways to meet the need for PPE in Manitoba. We're asking Manitoba manufacturers or businesses to rapidly scale up production or retool their manufacturing lines to develop products made in Manitoba. We're asking Manitoba suppliers and distributors to, with inventory or established channels to products to help in the fight against COVID-19 to step forward and help us. And we're asking those who can donate supplies to do so. Visit the information for businesses page at covid.ca/COVID-19 if you can help. We always remind Manitobans to use credible information in our battle against COVID-19. Fear and stigma are this virus's greatest allies. Knowledge and our actions is what it'll take to minimize the impact of this virus. Visit our website, manitoba.ca/COVID-19 for up-to-date information. All of these actions, looking at some of our recent numbers, is reaffirming that we are not helpless against this virus. The actions we take now will be demonstrated in the weeks to come, and as I mentioned, this weekend, these upcoming weeks are vital in our battle against this virus. We must remain vigilant, and together we're going to make it through this. And so thank you, Manitobans, and pass it over to Lanette.
Thank you very much. So I'm Lanette Siragusa from Shared Health. I'm the provincial lead for health system integration as well as the chief nursing officer. So I wanted to begin by thanking Manitobans who have generously responded to our call for donating medical supplies for COVID-19. In particular, I want to thank Princess Otto, who stopped by one of our depots with pallets of donated medical supplies. In addition, many schools and school divisions have donated various supplies, including gloves and gowns and face shields and safety glasses and hand sanitizer over the past week. So the generosity of Manitobans is unequaled, and I know that every member of our healthcare workers, our teams, joins me in saying sincere thank you. We have shared over this last week the challenges that we're facing, as are all other jurisdictions, related to supply chain availability, production, and distribution of personal protective equipment. And Manitoba is no different than any other jurisdiction. Last week was particularly challenging and a bit of a wake-up call that we cannot rely on our typical processes and our usual practices. Like other jurisdictions, Manitoba's supply stockpile has been significantly impacted by global pressures and requires a coordinated effort, bringing in infection prevention and control, occupational health, and public health to help guide us on what the appropriate protection is to ensure that our staff are safe and our services continue. At the same time, we're working with regional health authorities to analyze the needs of patients, clients, and residents. And in many cases, we have postponed elective, non-urgent surgery. We've changed diagnostics, who we're testing, and some of the procedures, and have moved to virtual care wherever we possibly can. We're still looking at temporary service changes that may be implemented in the home and community settings where we may have challenges with PPE. And those would be very temporary, but it's just the ongoing work that we are trying to manage. We are continuing to work with well over 600 vendors to acquire what we can in the market, including vendors like Canada Goose. They have reorganized their business processes to create medical-grade, reusable hospital gowns for our physicians and staff. We have outlined the guidelines for extended use of medical PPE where it's safe and appropriate. And we continue to support innovation, including local efforts by our scientists and medical experts to reprocess N95 respirators for safe reuse. Earlier today, the government released a RFP for local industry to produce a new Manitoba-designed N95, which is reusable and will provide healthcare workers with the same level of protection as the difficult-to-acquire traditional N95s. A team of surgeons and other specialists from Health Sciences Centre have developed the design, which uses a 3D printed silicone base and applies to an N95 or a higher grade filter. So Manitoba has committed to the production of these masks and is seeking submissions for local manufacturers. So with every challenge we face, it truly is inspiring how people are coming together as a province to find these creative solutions. And I do also want to say that as the sands continue to shift in our procurement and logistics and supplies, one thing that has never shifted and is always top of mind and in every conversation is the importance of making sure that our staff are safe. And we work so hard. It's an unwavering commitment that we make to healthcare workers. So what I would say is we sometimes hear from the media that there are challenges, and I don't doubt there's challenges, but when those challenges arise, we need you to make sure that your voices are heard and to know that your concerns are important. And we want to hear if there are challenges. We want you to talk to your managers. We want you to be part of the solution. So we're going to continue to work on this, and we are committed to all of our healthcare workers being safe. On that note, I also want to say that we have made some changes to our staff health processes. So starting today, symptomatic healthcare workers no longer need to go to staff health prior to going for testing. They can go directly to the testing site, show their ID, tell them they're symptomatic, and get swabbed right then and there. And then what we would ask is that you connect with your staff health after that, so we can ensure that you get your reports back and any follow-up that's required. As well, we've added additional staff to occupational health, 10 extra people to help with the workload. We've added new phone lines, so just to improve the access and the flow of information. So just to go on to operational matters. So we heard yesterday from Winnipeg that the testing sites were not seeing as many people as they normally would, and they just wanted us to send a reminder that they're still open for business throughout the holidays if you need to go see them. Sites in Flin Flon, Thompson, and the Pas are open daily throughout the weekend from 1 till 4 p.m. The Mount Carmel Clinic in Winnipeg will be closed on Easter Sunday. Everything else, as far as we know, is open for business with their normal hours. And for up-to-date information on community screening sites, including their address and hours of operation, you can go online to manitoba.ca/COVID-19. A message from Cancer Care Manitoba. Several counseling and support services are continuing at Cancer Care Manitoba, albeit there are some modifications that are related to COVID-19. Cancer patients or their families who are in need of counseling will still receive services, but it will be over the phone instead of in person. Some less urgent services, meanwhile, have been placed on hold for the time being. And these measures are being taken to protect the cancer patients, their families, and the staff. So any clients whose appointment has been changed will be contacted directly. And one last topic to discuss with you is volunteers. So regional health authorities and healthcare facilities are always looking for qualified volunteers to help with staff and patients. And as we continue to ramp up our efforts in response to COVID-19, we expect our need for volunteers will also continue to grow. So right now we do have volunteers helping out at the testing sites, at the call centers, and with employee assistance programs. But going forward, there'll also be opportunities to volunteer to help with administration functions, as well as roles that have face-to-face interaction with patients. So we'll be reaching out to Volunteer Manitoba and other organizations in the days ahead, and we will be asking them to work with us to find volunteers that can help. We will eventually expand that request also to private and non-health-based organizations. So to that end, if you are in Winnipeg and you're interested in volunteering, you can please go online to wrha.mb/COVID-19 volunteers. And if you live outside of Winnipeg and you want to volunteer, you are welcome to call your local regional health authority for more information. And all potential volunteers will be screened for COVID-19 and any other risks. And with that, I will open the line to questions.
Thank you. A reminder to our reporters on the line, you'll have a primary question and a follow-up. And please reintroduce yourselves when you're called upon. From CBC Radio Canada, Laisa. From CBC Manitoba, Marina.
Hi there, Marina von Stackelberg with CBC Manitoba. Are any of the cases that you've announced today of healthcare workers, and if so, from where?
No, I don't believe there is any of these cases where healthcare workers. It's these are early reports, so only what would be written on the requisition, though. So more public health investigation would be ongoing.
Thank you. And then a follow-up, we're hearing a lot about physical distancing hangouts, where people are meeting outside and staying 2 meters apart from each other, and also of people, walking, jogging, or biking on the streets that have been shut down. Do you have any issue with any of these activities? Would you discourage these sort of physical distancing hangouts?
Yeah, so I think that certainly as the weather gets nice and physical activity is important, right, for our health. So I think people need to find creative ways to be able to be out and active. But we need to always have that physical distancing, and so certainly if you're talking about hangouts where there's a number of people gathering, you do try to keep that 2 meter separation. It's still not something to be encouraged. I don't think any large gatherings, even with trying to maintain that appropriate distance, is what we're looking for right now. I think what the best advice is to try to stay home as much as you can. That doesn't necessarily mean stay inside. You can certainly get out and be active, but I'd really discourage the get-togethers of groups of people right now. Do so virtually. Right now, we're just in this vital aspect of our curve right now. That I think the best thing we could do is just try to minimize contact with others in person, and just do really these strict measures will keep this curve down.
From CTV Winnipeg, Jeremy.
Hi there, Jeremy Sharp from CTV Winnipeg. My question is in regards to personal care homes. Are you investigating any complaints of visitors being allowed into personal care homes? We've heard from some families that are concerned ordinary visits are still being allowed. What would your message be for those families?
So the visitor restrictions are still in place, and we're constantly evaluating them, but what's on the website is current. And we did allow for exceptional circumstances if someone is actively dying, if for compassionate reasons. So I think in anything we do, it's we can draw a line in the sand and say this is our preferred, but there's always exceptions to the rules. So I think on an individual case-by-case basis, we have to use clinical judgment and be human about the situation.
Thank you. And my follow-up question is just in regards to testing numbers. The significant drop in testing numbers yesterday. I think Thursday there were over 900 tests at the Chatham lab. Yesterday, only 175. Is that kind of expected on a Good Friday, or do those numbers mean anything else other than probably just a Good Friday and lower numbers than usual?
That's what we're thinking. Certainly we noticed that there is a decreased demand at all the testing sites, and so we're thinking that it was more about just the number of people showing up, probably because it was a holiday. So we want to remind Manitobans, if you're symptomatic, if you are eligible for testing, that we're open all weekend. It's still important to get tested, but I wouldn't make much of those numbers after a single day.
From the Canadian Press, Rob.
Hi, yes. I'm interested in these reusable masks that the province has issued the RFP for. they still need N95 material for the filters, though they need less. Where will you get that from? Where's that going to come from?
Well, I'm not sure about what the specifics, like what company they're getting the N95 filters from, but I do understand those alone are not as in hot demand as the masks that we normally buy. So the N95s will be created from this 3D mold and then attached to the filter, which is more easily accessible.
Is it safe? I mean, people hear reusable and they think not as safe. If that's the case, can you reassure them?
Yeah, for sure. And that's where we're working with infection control and staff health to make sure that the material for these masks are reprocessed. So whether it's autoclave or there's different ways we can sterilize the virus out of anything. So we'll make sure that the materials that are made for these masks can be reprocessed and reused and are constantly evaluated to make sure that they're safe. And the filter as well is really important. The N95 is one filter, but there's actually even stronger filters than that. So there's a host of different solutions we can incorporate.
From the Winnipeg Free Press, Melissa.
Hey, Melissa Martin from the Winnipeg Free Press. I just wanted to ask, as some of our reporting has shown, keeping to social distancing recommendations while sandbagging is quite a challenge. What are you recommending for people who have to sandbag properties?
Yeah, actually, there is a process that's been set up for sandbagging that actually does allow for fairly good social distancing. So the messaging is like other critical type services, they have to go on, and we have to do our best to minimize that. But I've reviewed some plans, and they're actually quite good, and they do allow for physical distancing. And our messaging is again, stay home if you're ill, even mild symptoms. They're going to have hand sanitizer around to ensure the good hand hygiene. And so the plans that I've seen actually look quite good.
Just a quick follow-up. If people are kind of out working and haven't quite put those plans in place perfectly, will enforcement of public health orders still be, will they be subject to that if they kind of do bend some of those rules during sandbagging?
Well, in sandbagging, so the public health orders that are in effect don't apply to government operations, so federal, provincial, or municipal government operations. So I would consider that sandbagging that type of operation. So, but the plans I've seen, there's processes in place to protect those workers. Certainly, options like wearing the non-medical masks are also an option in areas where you can't guarantee physical distancing. Again, that doesn't protect you, the person wearing it. It protects the people around them, but that's another option as well.
From Global, Eric.
Hello, this is Eric from Global. With respect to the efforts of both private companies as well as the RFP announced today for the reusable N95s, Lanette, can you give us an update on that order of equipment from the federal government that you'd spoken about earlier this week? Has that moved at all, or is it still being negotiated?
Yeah, no, we've had tremendous support from Minister Roussin and his team. And my understanding in our conversation with logistics this morning is those federal orders are starting to flow into Manitoba now.
And then a follow-up on that, and this is a question I seem to ask every time on the call. There's currently still not a significant increase in people presenting to hospital with respiratory symptoms at this point?
Yeah, that's correct. Our emergency visits are down. Our inpatient medicine beds are down like around 70%, and so is critical care.
From the Brandon Sun, Bud.
Hi guys, Bud Robertson at the Brandon Sun. Regarding the Manitoba masks we're using, will you be using the same sterilization process on these new masks as you are currently investigating for the existing N95s, and will you also be reusing those ones?
Yeah, I will have to ask Dr. Petropoulos, who's working on these masks, to, I would imagine if it's the same filter and material, it would be the same process, but I can verify that with you, Bud, and get back to you.
Okay, thank you. And the other question I have is, do you have any idea of how many of these made in Manitoba masks you are hoping to produce and a timeline for getting them out to frontline workers?
I think that will depend on the RFP, so who responds, how much they can produce, and we would like to say lots, but I think we can, as the RFP proposals come in, we can share that, and we're hoping, we really don't want to rely on outside sources as much as possible. We want made in Manitoba solutions. I just think that's our best bet for getting through the weeks and months ahead. So I can, as we have more information on that, Bud, I will be sure to bring that back.
From the Winnipeg Sun, Glenn.
Yes, the question I had was: are you surprised by the outpouring of companies coming forward to volunteer their PPE equipment and to step forward to retool their facilities to produce the PPE?
Well, I don't know if surprised. I guess happily surprised for sure. It makes me very proud to be a Manitoban, because people just come together and take care of each other, and it's if there's a silver lining to this situation, it's the acts of kindness and generosity of Manitobans. So I wouldn't say it's surprise. I feel like that's what we do, but it's a beautiful example, and it's great. We're very appreciative of everybody's efforts.
This isn't really a follow-up question, but it's a second question. Today, the City of Winnipeg is launching their community ambassadors program to get out to encourage people to keep their social distancing when they're out. Do you have any comment on that program?
Well, I think it's a great idea. I think it sends the message to Manitobans that how important it is right now that we keep our distance. We know that we're right in, and like I said, this weekend concerns me. Because it's nicer weather, it's a long weekend, a lot of traditions going on, so we need to do what we can to keep that message out to Manitobans that we can't let our guard up now. We need to do whatever we can to maintain that distance, and going to crowded parks is not one of those things, right? That if you're going to a park, you're seeing it's crowded, you got to turn around, and if you're there already and it's starting to get crowded, you got to leave and find a different place. And I think the ambassador program, just being visible, getting that message out, I think will start to really reinforce that message with Manitobans, just how important and how vital it is right now.
Okay, one more time for Radio Canada. Laisa, are you on the line? All right, then we'll open it up for questions. Anyone have a further question?
Hi there, Marina from CBC Manitoba. We know that older adults and seniors are the ones at risk here. The information you gave us yesterday shows that, those are the ones that are ending up in our ICUs. But we are seeing almost half of the cases right now are people under the age of 49. Is the province considering focusing messaging efforts on a younger demographic?
We're not going to be focusing it on in a demographic in particular. Certainly we want to have that focus on those that are at risk of serious outcomes because they need to take extra caution, and those around them need to take extra caution. But our messaging is to all Manitobans. We know that all Manitobans, every age group has been affected by this. So in all Manitobans to practice that social distancing, to stay home as much as they can. Those at increased risk of severe compromise, those over age 60, those with immune compromise, those with underlying medical conditions, especially cardiac conditions, hypertension, respiratory conditions, they need to be extra cautious, as do the people around them.
Bud Robertson for Dr. Roussin. Other jurisdictions and the federal government has now issued projections on COVID-19. I was wondering when Manitoba is going to follow suit and do the same.
Yeah, we are working on that as we speak, and so hopefully going to be able to provide some numbers to Manitobans in that regard. I would caution that in every jurisdiction, these are just possible projections, right? They're not the truth. Our actions are still valuable, and a lot of those whether we meet those projections or not will depend on our actions. So we will get some of those numbers. We want to keep suit. Of course, a lot of those other jurisdictions that released it have had cases 6 weeks longer than us. So we are on track to get ours out in time. But I want to just maintain that those are going to give us a range, and none of those numbers are set in stone. Our actions can change those numbers.
So the next week or two?
That's the plan. I don't have a specific date, but we're working on it, and that's within those next couple of weeks. That would be the timeline I'd be looking at.
Thanks, Dr. Roussin.
Hi, Rob Trent, Canadian Press again. Sorry if somebody's answered this in previous news conferences, but why do you want people to stay home from the cottage? I mean, can't you just self-isolate as easily there as you could at home?
Yeah, well, I mean, I think that when we start getting into specific scenarios, the messaging becomes difficult, right? Where we ask, people who, if they're self-isolating, can they walk their dog? Well, if you live in a house and you can walk your dog around the block without being sure that you can come in contact with anyone else, well, then maybe. But what if you live in a 20-story apartment block? Right, and the same thing here. Like, if only your family goes to the cottage and has no contact with other people, then it's essentially a low risk. But the message is really stay home. This is difficult times for Manitobans, but this isn't a time to travel. Traveling to the cottage may mean an extra stop at the gas station, may mean an extra stop at the grocery store, and so it's just the messaging is to stay home. Certainly, Manitobans can. Use their judgment in many circumstances, but the overall messaging is to stay home. Traveling out to other jurisdictions that may be less able to cope with medical illness should somebody get ill could put an unnecessary burden on them. So I think the overall message has to be just stay home as much as you can, only leave for essential reasons.
Jeremy from CTU Winnipeg. I'm wondering, the Ontario government has announced that it's going to be significantly expanding COVID-19 testing. They'll be testing hospital patients, essential workers, vulnerable people. What can you say about Manitoba thinking about expanding testing further?
Yeah, so we will continue to expand, but most of those ones that were listed in Ontario, Manitoba had already been doing. We already have been testing all hospitalized patients. We already test people in congregate settings. We already test people in remote isolated communities, as well as now first responders and healthcare workers. So a lot of that expansion was already taking place in Manitoba, but we're going to continue to look at and respond to our local trajectory and expand testing as required.
Okay, thank you.
Melissa Martin from the Winnipeg Free Press. We heard today that potentially provincial correctional facilities are looking at moving to some additional measures next week in terms of, we heard potentially mandatory masks for inmates and staff, as well as temperature checks. Are you able to comment on any of those plans moving forward?
I don't have any details or confirmed plans. I know that that's been something that they're considering. And again, those wearing non-medical masks can provide added protection when social distancing is not always feasible. And so again, it doesn't protect the person wearing the mask, really. It protects the people around them. And so it's something that they're looking at, but I don't think there's been any final plans yet.
Thank you. Marina von Stackelberg here from CBN. Are all hospitals supposed to be checking the temperatures of healthcare workers as part of that pre-entry screening? And if not, when will those be implemented at all hospitals?
We do recommend that they do check the temperatures, but if there's not enough thermometers, those are on order and will be arriving soon.
Just to follow up, do you have an idea as to timing on that when you say soon?
I can check with our logistics and see where that is at and get back to you.
Great, thanks.
We have time for a couple more questions if anyone has a final question. Thank you, and that concludes today's media briefing.
Thank you.
Thank you.